I'm glad to introduce Dr. Ann Garland, who is here to tell us about her career path for SSCP's How Did I Get Here video series. Dr. Garland received her PhD in clinical psychology from Yale University. Following that, she spent 20 years at the University of California, San Diego, and the Child and Adolescent Services Research Center, where she led federally funded research designed to improve access and effectiveness of community-based child and family mental health services. As a professor in the Department of Psychiatry at UCSD, she taught and supervised in the SDSU-UCSD Joint Doctoral Program in Clinical Psychology and led the child outpatient track of the UCSD Psychology Internship. For many years, Dr. Garland has been actively involved in mentoring mental health services researchers and practitioners. In 2012, Dr. Garland made a significant career shift. She is now professor and founding chair of the Department of School, Family, and Mental Health Professions at the University of San Diego, a smaller private university. Her department includes graduate programs in counseling with specializations in school and clinical mental health counseling and marital and family therapy. As department chair, she has significant administrative responsibilities, but also teaches and continues to pursue collaborative research activities. Dr. Garland, please describe your career path and tell us about any obstacles or barriers that you overcame along the way. In addition, tell us what has surprised you about your job and what you wish you had known earlier about this type of position.
Thank you very much, Sarah. Well, when I think about my career path, I think of the metaphor of a freeway. You've got to remember that I'm in Southern California, so a freeway doesn't necessarily mean it's been speedy and consistent all the way through, but it does mean that for most of the time, it's been fairly straight and one going in the same direction, unidirectional. That really was very, very true up until 2 years ago, as you mentioned, when I made a fairly significant shift. I took a pretty radical turn for me. It felt like it, and it continues to feel like it, but in a very stimulating and invigorating way. And I'll talk a little bit about the straighter part of that path, and then the turn and how that's been and what I've learned from that. Going back a ways, my interest in psychology and specifically clinical psychology from a public health perspective started as an undergraduate. So I was pretty clear that that was the career path I wanted, in at least generally in the field of psychology and in applied aspects of psychology as an undergraduate at Berkeley. People, I volunteered as a research assistant, and the first position I had was doing more experimental work with fish, as a matter of fact, with guppies, and tracking them in a tank, and did it go to the right quadrant or the left quadrant? And while that was interesting, it was actually a little bit of a bump in the road for me because I didn't find it scintillating. It wasn't for me. I realized that I wanted to do more applied work, and I was very, very fortunate to have the opportunity to work with Mary Main at Berkeley as an undergraduate on the adult attachment interview, and that sealed the deal. I recognized that I wanted to do research that was more applied. I absolutely admire the folks that can do the more basic experimental research, but for me, I think I needed it the relevance to the real world had to kind of hit me on the head more directly, more clearly. So that was a very important turning point for me. I also pursued more clinically active positions. I worked in a group home with individuals with autism and other developmental disabilities, and that was eye-opening. Also great training, and probably the hardest job I've ever had. It was a job where I needed to spend the night, several nights a week, and work all night long with the residents, but a great training ground for learning basic behavioral principles. So that's what I did right after college. Ended up moving to New York City for an adventure, having grown up in California and been in California all my life until then. And I love New York City. I got a master's degree at Columbia University, and then I was incredibly lucky and got a research assistant position at Columbia and New York State Psychiatric Institute, working with David Schaffer in child and adolescent psychiatry. We were working on studies of adolescent suicide prevention programs. So that was another just incredible training opportunity, working with very smart people on important topics. I got a lot of early experience working in the community because one of my jobs was to go out to high schools throughout New Jersey. I got to know the Turnpike. So driving, I'm a Southern Californian, driving is going to be a theme here. But we visited high schools and we were collecting data on the impact of curriculum-based suicide prevention programs. Another just formative experience for me. If there's a lesson in this so far, and that lesson for me continues, is just, find the smartest people you can to work with, and you'll learn a lot. And I feel like I've been very, very lucky in that regard. From there, I applied to PhD programs, got into Yale, thankfully, and had an amazing experience in graduate school in a number of different ways. My professors, my peers, my clinical training, everything was just, I couldn't have asked for more, quite frankly. My mentor in graduate school was Ed Ziegler, another just, I lucked out. I feel like I hit the jackpot. Just a wonderful man who taught me a lot about how to translate research into practice and policy. And that's really always been a passion for me. Like I said, starting off as an undergraduate, I needed to be doing research that I could see a direct potential improvement in services, in policy, in practices. And for me, Ed Ziegler was the perfect model of that. Someone who had done that for his whole life and had worked in the White House and developed Head Start and really believed in not just the quality of science for science sake, but using that information to improve the lives of children and families. So obviously that resonated for me, to say the least, and has been a mission for me my whole career. So again, couldn't have asked for a better mentor there. Let's see. So we're at Yale now. I think one of you asked about challenges, obstacles. I don't really see it as an obstacle, but certainly a challenge that I imagine other graduate students can relate to was the sometimes perceived dichotomy between the research academic training and the clinical training. And that was definitely true for me. I didn't experience that as a problem per se or as an obstacle, but it was a challenge because they were kind of separate worlds, separate faculty teaching us from a research perspective versus a clinical perspective. So at times it was hard to reconcile the two, to kind of integrate what I was learning in terms of science and how to pursue science, and what I was learning in terms of how to be the most effective clinician. I feel fortunate, though, that I got a wide breadth of clinical training from a variety of theoretical orientations, really, skilled clinicians who were my supervisors. I didn't always agree with them, yet I feel like I took skills and knowledge from each, even those that I didn't necessarily agree with their approach. So that's another, I suppose, piece of advice. Even when you don't necessarily share a theoretical orientation, for example, there probably are a lot of things you can learn from a supervisor. It's not an all or nothing phenomenon. So that was an experience I had in graduate school with supervisors who range from traditional psychoanalytic practitioners to those that were family systems oriented, those who were, pretty basic behavioral interventionists. So a wide range, and I think that was a really valuable opportunity. I don't know how common that is nowadays. In more, programs tend to specialize more early on. I think that's my experience, but I think I was lucky in that respect. Okay, on this journey, on this highway, we've finished at Yale. I came back to San Diego. San Diego was home for me. My family's here, my roots are here, and that kind of provides another tangent for me to talk a little bit about balance. And, we hear so much about balance, we talk so much about balance, work, life, etc. For me, one of the things I'm always talking to students about, trainees about, colleagues about, is the importance of geography and being in a place where you feel comfortable, where you feel supported. I know that sounds obvious, but oftentimes we face career decisions that may take us somewhere where we don't, may not want to live there. And at certain points in one's life, of course, there are trade-offs, but to be in a context where, I wouldn't give up for the world the opportunity to, be with my aging mother, to have my daughter grow up with her cousins, who are almost like siblings to her because they're here in town. And this is a little bit of a tangent, but it's relevant to me, at least, because it has dictated some of the decisions I've made in my career. The desire to stay in a particular geographic location that means a lot to me. So for me, that's worked well. I feel incredibly lucky that in San Diego, I found a group of colleagues and mentors early on that shared my interests and passions in terms of research. We worked in the Child and Adolescent Services Research Center, acronym CASRIC. Still going strong. I was there, as Sarah mentioned, for 20 years, and I'm still there, although more remotely now. The work that we have done has focused on access to mental health care, effectiveness of mental health care. Over the past decade, more and more on the implementation of evidence-based practices in the community, models for training clinicians, sustaining evidence-based practices, the organizational culture of clinics and agencies, all kinds of things, but all on the kind of far applied end of a research spectrum. So again, that fit for me. I loved being there. It was for me an incredibly generative place, smart people, creative people, hardworking people. It's a multidisciplinary center, and that's another important quality or characteristic for me. And I think that's been true from way back when, from graduate school on. Ed Ziegler, again, modeling. He had a center where he brought in people from different disciplines, from different backgrounds. For me, that is essential to keep oneself really stimulated and to challenge some of your ideas that come only from your own discipline. So at CASRIC, we work with anthropologists and epidemiologists, biostatisticians for sure, pediatricians, nurses, I'm forgetting some of the disciplines, social workers for sure. So really important for me in my career to be working collaboratively with people who come from different training backgrounds. That I think has enriched my research. It's probably enriched my teaching, I'm sure, and it's just been stimulating for myself. What else do I want to say about CASRIC? And I was also doing a lot of work with PhD students, and that's one of my favorite parts of my job was mentoring students, whether it's as their primary advisor in the doctoral program, or whether it's as a clinical supervisor, dissertation committee member, whatever it may be. That's been the most rewarding part of my career so far, for sure. I did a lot of work with interns and really enjoy that as well, supervising clinical supervision and kind of mentorship in general for career development, professional development for interns. I love that. But then after 20 years, I did make a big switch. So the highways going straight ahead for a long time, sometimes moving more quickly than others, but I decided to take a turn. Really, an opportunity presented itself that seemed almost too good to be true. And it was a very unique opportunity to come here where I am now, to the University of San Diego. I know it's a little bit confusing. We've got the University of California, San Diego. We've got the University of San Diego. Actually, very, very different institutions, from the large state research institution at UCSD to a small private University of San Diego. I am now the chair, department chair. Our department has this long-winded name to be all-inclusive. Sarah mentioned it, the Department of School, Family, and Mental Health Professions. We include counseling, school counseling and clinical mental health, as well as marital and family therapy, MFT, master's level programs. So we are working on developing a PhD program over time, but right now, only master's level. Such a different environment, night and day. Priorities, very, very different. My role, very, very different as department chair. I'm also a full professor here, but really the majority of my time is in leading a department and bringing programs that had previously been independent together under one roof. So that's been a challenge. As you might expect, it kind of harkens back to what I talked about multidisciplinary work, interdisciplinary work. So I feel like my whole career, it may be surprising, I'm a clinical psychologist by training, but I've never worked in a department of psychology. So I was a professor in the Department of Psychiatry at UCSD. Now I'm professor and department chair in a department with a long-winded name, but essentially counseling and therapy. My experience with different disciplines, I think, was key to being hired here, essentially, because they needed somebody who could bring different faculty together, people who, quite frankly, didn't necessarily want to be in a department together. They were pretty happy having their own kind of siloed programs, and the decision was made by the dean and the provost to form a department and bring them together. So it's been a challenge. That's why my official title is founding chair, because it's a new department, and so I'm the first chair, which has been amazing in terms of a learning opportunity. I really wanted to make this switch for a few reasons. Number one, it was a chance to really challenge myself with a different role, to learn more administrative skills, to test myself in that way. It also felt like a very good next step from all the research that I had been doing on community-based care. Frankly, I believe that we are training the mental health workforce here. We are training the people that staff clinics and nonprofit agencies, and I wanted to have an impact, a bigger impact on that mental health workforce. I wanted to work on the curriculum and infuse evidence-based practices and an appreciation for continued learning and for being really good consumers of research and throughout their careers. So I feel like I am able to do that here. I guess it sounds sort of defensive, and I don't mean it to, but it was an unusual choice for me. It was a really unusual choice. I think there were colleagues that were somewhat surprised, and then many colleagues who knew me who weren't surprised at all, because I really always have had a passion for training clinicians, and that's what we're doing here. It's you asked about what has surprised me. I think what has surprised me in this job is more I think I never knew what was going on in the background in a university, all the administrative decisions that need to be made, budgets and personnel issues and policy issues. So I was pretty protected from that for many years, and I'm glad. It gave me an opportunity to focus on what I wanted to do, which was to do research and to teach and to train people. Now I can't avoid all that. I'm in the midst of it, and it can get frustrating sometimes, but it's really eye-opening. It's really a good learning experience for me. I enjoy the contrast of being in a small university. There are so many fewer layers of bureaucracy. I know the dean very well. I know the provost. That's not bragging. That's just because we're a small group. I had never met the dean over 20 years at UCSD in the School of Medicine, not surprisingly, perhaps. So that gives you just a little bit of a contrast. There are pros and cons, of course, to every type of institution, and this has just presented some unique learning opportunities for me. And I really enjoy, I still get to work with students. I find that the best days, frankly, are not the days that I'm spending lots of meetings on the administrative side, but the days that I get to meet with students and, hear more about their career interests and challenges, and do some clinical supervision here, which I love again. So that's been the one constant across the years. So what else do I want to say about that switch for me? Well, probably one of the major factors also in the cost is the type of position at UCSD. All those years of doing research, I was a little bit of a mix between what we call a soft money funded position and a hard money funded position. So I received some salary support for the work that I was doing in leading one of the tracks of the internship and doing clinical supervision in the outpatient clinic. So some of my salary was harder, as they say, but most of my salary for all those years was covered. I covered it through grants and contracts, program evaluation contracts. I feel, there were lean times, there were flush times, and I think that's the way it goes. And that's one of the things that graduate students, postdocs, early career folks need to think a lot about. And I've had so many conversations with people about the relative advantages of a quote unquote soft money funded position versus hard money funded position. And for me, a lot of that decision making for people, it boils down to kind of security and the need for both, just literally. I mean, if one is a single earner for an entire family, I don't know if a soft money funded position is very realistic. There's a security versus more entrepreneurial, I can finally say that word, balance there. Having a research career that's funded by your own grant dollars or your colleagues, you're working together, is amazing in terms of the autonomy that it gives you, in terms of the sense of discovery and the excitement. There really is an excitement that you are, pursuing your passions and your research, but it's also risky. And it feels, I used to always joke that, if somebody asked me about it in the first year of getting a big R01 funded, it's the greatest job in the world. And it really is. I mean, somebody gives you a lot of resources to do the project that you wanted to do, and you get to lead it, and it is phenomenal. It's wonderful. It couldn't be better. But on those other years where you have what you think is the greatest idea in the world for a study, but you can't seem to convince reviewers that it is, it's not the greatest job in the world. It's hard, it's stressful. But I feel fortunate to have had that experience for all those years, and to have enjoyed amazing colleagues working together on projects and sharing kind of resources whenever possible, and having amazing trainees working on those projects as well. But it is a very stressful existence when you're relying on external funding for your work. Ideally, you want to find a balance. So now I'm in a position where I do not, and I have a full-time salary, and that is a luxury. It feels very different to me, and I enjoy it, I have to say. I also enjoy the more traditional academic calendar. As a School of Medicine professor, it's a 12-month job. As in a more traditional academic role, the summer, having just enjoyed a more relaxed summer that gives me a little more flexibility and time to travel with my family, to write, certainly, to do a variety of other things. So there are big trade-offs in terms of the type of job from a funding perspective. Those are some of the things to think about in terms of advice. I think the other thing, just one other point, I'd written a note to myself about this new position that I love, is a broader definition of research and scholarship. So I was in a School of Medicine that had a pretty clear definition of the type of research that was most highly valued. Now I'm in an institution very, very different. Values community engagement, community service, values that kind of translating research into practice and policy as a very high priority. Values global education. So we have some really interesting courses that we offer abroad. They're only for a couple weeks, but at a time, but where we immerse people into different cultural environments. And I think I've talked to students who talk about it as life transformative. So it's pretty cool. So I'm in an institution that has different values. I'm not suggesting, better values necessarily, but just different values. And that is invigorating to me. So kind of figuring that out and figuring out my place in that, my role in that, and how to maximize that for myself, for the faculty members in my department, and for the students has been really energizing. So I think I've used that word a lot, and that's how it's felt the last 2 years. So as much as I loved my work I was doing, to make a big shift has been energizing at this stage in my career. And then I guess final sort of, advice, if you will, lessons learned. I think that this should be just common sense for everybody, but I find that it's not always, and that is the importance of interpersonal relationships, professional relationships is what I'm talking about now, collaborative relationships. I think sometimes students become so focused on the kind of substance and content of their work that we can ignore or not pay enough attention to the quality of our professional relationships. And I just urge you to make sure that doesn't happen. And I think that for me, I know it sounds cliched, but it's so true, that the most valuable, enriching part of my career has been the relationships that I've developed, whether it's with mentors, whether it's with students, whether it's with peers, colleagues, local and remote. That's what makes this worthwhile. That's what makes it That's what affects the quality of my life day to day. And even if you don't want to think about it in terms of those warm, fuzzy quality of life aspects, strategically, you're going to need these people. You're going to need to have colleagues. If you alienate folks, if you are not generous with your own time, if you are not collaborative yourself, you can't do this kind of work in a silo. As a lone wolf, so to speak. I've seen people who've tried, and I think that that's one of the most important pieces of advice. Again, it seems like common sense. It boils down to the golden rule, treat people as you'd like to be treated. But I would really like to emphasize that, both from just a quality of life perspective and from a strategic perspective. As crass as that might sound, these are folks that are going to be reviewing your papers, reviewing your grants, people you're going to need to call on for a favor. And so make sure that you're thinking about that from early on, because the folks that you're in graduate school with, or if you're undergraduates, they may likely be part of your professional network in the future. So don't forget that. And then the only other kind of advice or lesson learned is one thing I think we don't learn enough about in graduate school is and I don't know if this is exactly the right word, but the marketing aspect that is so crucial in your career. And that goes across the board. Obviously, as a researcher, part of the challenge of grant writing is it's not just about the science, and it is really about how you package it, how you sell it. So marketing is the word I'm choosing to really reflect everything to do with how you sell your work, how you sell yourself, how you sell your skills, your talents. That's been eye-opening for me throughout my career, how essential that is, and how some people are very, very good at that naturally, but we don't get a lot of training in that at any step in our career. So I think if I could urge you to kind of think about that, it's true if you're going to be a clinician, it's true if you're going to be out in the community developing programs, it's particularly true if you're going to implement programs. You need to have those kind of marketing skills. And I don't know, other than finding good mentors. I had some great mentors early on who were very entrepreneurial, and I think taught me a bit about that, because that didn't necessarily come naturally for me. So that's another piece of advice I would give in terms of the types of training opportunities, knowledge, skills. So that's what I have to offer, and I'm very much looking forward to seeing these other videos from other folks. I hope that's helpful, but it's been a great ride so far, and it's not over. It's in a new chapter, new off ramp, new different highway going in a different direction. I don't know how long I'll stay on this highway. May want to go back to the other more traditional research path. Not sure yet. We'll see how it unfolds. Thank you very much.
Thank you so much, Dr. Garland.